Are your prescriptions depleting your nutrition? Hi, I'm Dr. Crockett, and this is Dr. Crocker with Zeal Integrated Health. And today we want to talk about one of the common things that we see across America is just nutritional deficiencies. And these minerals and vitamins, they're just necessary for normal just organ function, gland function, and really energy processes in the body. And so what we find is that, if you just look at the American population, 73% of people out there, between the ages of 55 and 65 are typically taking at least one pharmaceutical. And unfortunately, one of the side effects of these prescriptions is just nutrient deficiencies that are developed. They deplete some of these common vitamins and minerals that you need. So we're going to talk about first the classes of pharmaceuticals that can deplete nutrition. So let's talk about that first.
Yeah, so one of the things that we see a lot is patients that are really taking non-steroid anti-inflammatory drugs, ibuprofens, different things like that. Statin drugs, you see this kind of across the board. Lots of people are on statins nowadays. Things like antibiotics, diabetic drugs, selective serotonin reuptake inhibitors. That's going to be like depression type of drugs, which, one of the things that we see quite a bit of is people on these type of things, and they really deplete a lot of nutrients nowadays.
Yeah. So these common things, you don't even think about it, over-the-counter ibuprofen.
Yeah.
The antibiotics that you get prescribed when you're, having an infection and dealing with those things.
Yep.
Now, we're not going to go through all of these things and list all of those, but we want to take a couple of them and we're just going to use them as an example and kind of talk about what they deplete. And of course, this is not the end all of list here to look at. So definitely, if you've got more questions on this, give us a call. But I want to start with statins because so many people are placed on these cholesterol lowering medications. And I think it's important to understand what they're depleting and make sure that your doctors are observing or testing for these things. When you look at statins, one of the first things you start thinking about is how they can impact just things like B vitamins. They're going to have an influence on CoQ10.
Yep.
They're going to drop calcium. They're going to have an influence on calcium levels, vitamin A levels. The vitamin D is another one that's affected.
Yep.
And magnesium. Magnesium's probably one of the, if you look at deficiencies across America, probably one of the highest things that we find that people are deficient in.
Yep.
And of course it has a major influence on heart function, just the heart palpitations and the heart rate variability. So these are things that need to be monitored and observed to make sure that these cholesterol lowering drugs are not creating another issue. Might be helping with the cholesterol, but is it causing something else to develop?
Exactly, and that's where we see another class of drugs out there are diuretics. We see lots of patients on these. They use them for blood pressure medications. They use them for patients that are especially diabetic. We see that a lot in our practice here as well. And they're going to reduce things like potassium. Another one is magnesium, just like we talked about earlier. Calcium, those are kind of some of those main key factors that you see get decreased in this. Really the big one that we see a lot is as these drugs force urination out, they're going to actually deplete B1. And what that does is it decreases your sugar metabolism, which when you put a lot of patients are on that are diabetic, it's actually going to hinder some of those aspects. So you need to reestablish your B vitamins back in your system.
Yeah. You'll see a lot of times these things can be identified through testing. And what I see is a lot of times people are prescribed these, but the follow-up testing is just not getting done. So, making sure that you're getting blood testing ran to evaluate these things. You can run saliva testing. There's DNA testing to analyze maybe if your genes are playing a role in your ability to really absorb these nutrients. If you look at things like vitamin D, there's a small percent of the population, maybe like 3% of the population, that just can't absorb vitamin D like other people. And so that influences how much you need to be taking in. And if you get put on something that's going to increase the depletion, obviously that's important to know. So check out some of the other videos and remember to subscribe below.